A new coronavirus subvariant, XBB. 1.16 has been designated variant under monitoring by the World Health Organization. The latest Omicron branch is particularly prevalent in India, where it has led to an increase in infections and reverted to mask imperatives parts of the country. Choose your plan. ArrowRight. What you need to know about the subvariable Arcturus, documented in 29 countries so far. What is the new coronavirus subvariable Arcturus? Arcturus was first detected in a sample from January and has now been documented in 29 countries, according to the World Health Organization. This is a subspecies of the Omicron variant, which emerged in late 2021 and has replaced Delta as the dominant variant worldwide. In late February, the Arcturus species accounted for 0.21% of the world's cases. A month later this had increased to 3.96%, according to WHO figures. According to Centers for Disease Control and Prevention, it's estimated to account for 7.2% of coronavirus infections in the week ending April 15 in United States. WHO designated XBB 1.16a tracked variant on March 22. This means that the variant has genetic changes that could affect its characteristics as a virus, including a possible growth advantage over other variants, but the epidemiological impact is not clear. WHO is tracking 7 variants, including the BA.2 Omicron version seen in many parts of the United States. According to WHO, a variant under monitoring is considered less of concern than a predicted known, relevant variant to be more infectious or lethal able to evade antibodies. XBB. Strain 1.5, currently the most common subvariable globally, is identified as a variant of interest. Does the Arcturus mutation make it more dangerous? According to WHO, Arcturus is similar to the common XBB. The 1.5 variant, however, has an additional mutating mutation in the spike protein that showed high infectiousness and potentially increased pathogenicity in laboratory studies. We've seen this in the past, Paul Hunter, a professor of medicine at the University of East Anglia in England, said in an interview. You look at the virus and it has mutations that should make it more lethal, but you don't really see it. He explains immunity in bodies T cells represents one of greatest protections, but that still, we don't see much evolution in parts of virus T cells actually attack, so mutations may have an effect. Annoyed. There is no evidence that this is more severe, and possibly slightly less severe than previous strains, but it's too soon to be definitive. And this is almost certainly due to immunity. It will likely become the dominant variant for some time in the US, Europe and